Hello and welcome to Mavzone Dentistry. In this episode, we will continue on from the previous topic and discuss about the diagnosis of pulpal pathologies. In this second part, we will be discussing the different diagnostic terms used for pulpal pathologies and discussed most common treatment for pulpally affected tooth. Once a patient approaches us with pain in the tooth, it is important to learn how to clinically differentiate between the pulpal and periapical pathologies. We will be doing this subsequently in today's lecture. But first, let us discuss each of the pulpal diagnoses as suggested by the American Association of Endodontists. 7 diagnostic terminologies have been designated to describe the various conditions associated with the pulp. This was given during the consensus conference of the American Association of Endodontists and have been found to be quite useful in determining appropriate treatment for the tooth. The schematic representation here shows all these terminologies. Let us now discuss each one by one. The pulp is considered to be normal when it is asymptomatic and has not shown any history of pain. Clinically, the tooth will not show any deep carious lesion and there will be no history of trauma associated with that tooth. Intraoral periapical radiograph will show a sound tooth or a carious lesion that is not involving the pulp. The pulp will be normally responsive to vitality tests. Reversible pulpitis is a clinical diagnosis that is based on subjective and objective findings, indicating that the inflammation should resolve and the pulp return to normal. As discussed before, this is not a common diagnosis since the patients generally do not show up for dental consultation at this stage. The patients generally complain of pain due to thermal stimulus. Clinically, the pain is immediately relieved after removal of a thermal stimulus. A diagnosis of symptomatic irreversible pulpitis is classic and is also based on subjective and objective findings. Patient gives history of spontaneous pain which is lingering in response to a stimulus. There is increase in pain on lying down which is suggestive of inflammatory edema in the pulp chamber. Clinical examination reveals a sharp pain elicited on thermal stimulation which persists for a short duration even after the removal of stimulus. Intraoral periapical radiograph will reveal a deeply carious lesion or involvement of the pulp chamber. The pulp will be responsive to vitality tests. The diagnosis of irreversible pulpitis means the pulp tissue is no longer capable of healing. Asymptomatic irreversible pulpitis, on the other hand, is considered when the tooth is asymptomatic at least during the point of presentation. The patient might give a previous history of pain in that tooth which might have resolved on taking medication and did not receive any further treatment. Lack of symptoms does not mean that the pulp is normal, but an infection which is low grade and has resulted in a chronic low grade inflammation in the pulp tissue. Intraoral periapical radiograph will reveal a deeply carious lesion or involvement of the pulp chamber. The pulp will be responsive to vitality tests. Careful clinical examination and a thorough history is essential to diagnose a tooth with asymptomatic irreversible pulpitis. Persistence of an acute infection within the pulp tissue, if left untreated, will lead to abscess formation and subsequently to the necrosis of the pulp. Alternately, a low-grade inflammation as seen in a traumatized tooth might result in the degeneration of the pulp tissue. Pulp necrosis is considered as a diagnosis when the tooth is asymptomatic upon presentation. The patient might give a previous history of sharp pain in that tooth or a trauma many years ago. In case of a traumatic tooth with necrotic pulp, the color of the tooth would be yellowish. The most important point to remember here is that the tooth will be non-responsive to pulp vitality tests. The next 2 diagnostic categories have been included in relation to patients presenting with complete or partial root canal treated tooth. A diagnosis of previously treated is given when the tooth has been root canal treated, obturated, and may or may not have been restored with a crown. Such teeth are generally asymptomatic but may show supra-eruption due to lack of a crown. These teeth are susceptible to fracture, which would then make the prognosis worse. It should be noted that just the presence of intracanal medicaments does not count as an obturated tooth. A diagnosis of previously initiated therapy is given when root canal treatment was initiated but the tooth was not obturated. the only treatment done for the tooth would be pulpotomy, pulpectomy, or partial biomechanical preparation. This is mainly due to the high cost of treatment, wherein the patient does not show up for further consultation once the tooth is relieved of pain. The tooth may be asymptomatic at presentation but is highly susceptible to periapical infection. Identification of this condition is hence important, and the patient has to be educated regarding the effectiveness of completing the root canal treatment and the need for completing it. After establishing a pulpal diagnosis, the next step is to determine the treatment. Root canal treatment is the mainstay of treating a tooth with irreversible pulpitis. These teeth cannot be restored by simple restoration, and sometimes the tooth has to be extracted when the patient is unable to afford the cost of the treatment. Previously treated tooth may need a root canal treatment so as to remove any residual foci of infection prior to restoring the tooth. An affected pulp, when left untreated, will result in the extension of the inflammatory process into the periapical area, leading to periapical pathology. We will be discussing these pathologies in another episode. An understanding of the topic sequelae of pulpitis is recommended in this regard. So, these are all the diagnostic terminologies which are considered for designating a pulpal pathology. In the next episode, I will be discussing the percussion test in detail. This is a very useful clinical test and can be mastered with simple practice and understanding of the concept. That's it for now. Thank you for watching. Stay safe and see you soon.